So Renee and I decided to do magnesium sulfate. I believe she already passed around a study guide for you guys, so feel free to take notes. I'll give you some page numbers. Bruner, page number 262. Ricky, page 652. And Davis, page 808. So I hope you enjoy. So why is magnesium important for your body? Well, it works with calcium to contract your muscles. So if you have too much magnesium, it'll decrease the contractility. So where would that come into effect in your body? Well, your lungs for one, and also for your heart, which is the two most important things that you could possibly need. It also produces vasodilation. What does that do for your blood pressure? Think of a water hose. If you have too much pressure, it makes it go up. But if you vasodilate, you decrease the pressure. So you have to monitor that when you give these patients is magnesium sulfate. It's also excreted in the kidneys. So that's very important to learn about your patients, is their BUN and creatinine, their labs. So normal magnesium level is 1.3 to 2.3, and that's per Bruner. I know it says it differently in every other book that you look at, but we're going to go with Bruner. So again, that's 1.3 to 2.3. But what happens when your magnesium falls below 1.3? Well, remember we were talking about the neuromuscular contractility of your muscles. Well, if they always say too much of something is not necessarily a good thing. So that can decrease your respirations. It can cause hallucinations. It can cause seizures. You can get confused. And extreme agitation. So basically, hypo, you go. Hypo, you go. So it might make you shake, make you real agitated, irritated. Hypo, go. You might actually find Chvostek's and a Trousseau's sign as well. What did I just say? Chvostek's and Trousseau's? Chvostek's and Trousseau's, you say? Yes, I did. But isn't that related to calcium? Yes, it is. But here's the reasoning behind that. If you have a low magnesium, you're also going to have a low calcium. So how do you check for Chvostek's sign and Trousseau's sign? Well, here you go.
Okay, go ahead and squeeze your hand for us. Go ahead, squeeze like that. Good. And then back out. All right, that won't increase. You can relax your hand down.
You can just relax and keep it like this, please.
Okay. And just let us know what you're feeling as we're doing this.
It's trembling right now. I'm going to sleep.
Okay.
Now it's starting to curl.
What do you mean? What do you mean trembling?
It's starting going like this. It's shaking.
Can you control your hand?
No.
Okay.
It's going like this by itself.
Try to straighten your fingers up.
I can't.
You can't do it.
I can't.
All right. What do you feel right now?
I want to go like this and flatten them
You're
back
trying
out.
to.
Yeah, but I can't. This goes way in here like this.
Yeah.
And will not move.
Up.
Now look, it's crunching even more.
And you're not doing that.
I'm
right?
not doing that.
Okay.
Matter of fact, I want to pull it back out. See see the other one is doing it too.
Right, and this is what happened earlier to you.
That's what happened over here.
Okay.
It went just like that.
I'm going to release the pressure now.
Oh, see, it's pulling it more down.
Let us know how you feel as it...
There, see?
Now, what's it feel like?
It's fine.
Totally
it's not fine, but it's sleep.
I see. Now move your fingers for us. Okay.
Great. Wonderful.
So what are some of the causes of hypomagnesemia, you ask? Your diet. If you're not getting it in your diet, such as dark leafy greens, dark chocolate, bananas, beans, low-fat yogurt, whole wheat, things like that. Besides that, you have a lot of magnesium in your GI tract. So with diarrhea and gastric suctioning, you can lose a lot of magnesium. Also chronic alcoholism and diabetic ketoacidosis. That's kind of a big jump there. Diabetic ketoacidosis, why is that? Well, if somebody's having diabetic ketoacidosis, they're diuresing. That means they're urinating a lot. And of course, magnesium goes out through your urine. There you go. So how do we fix it? We already talked about the diet, but also we can give IV piggyback magnesium sulfate. And it has to go on a pump. Magnesium cannot be IV push. But what happens if your patient gets too much magnesium? Well, remember I said hyper, everything kind of stops. So you might have a decreased pulse. You'll have a decreased respirations. You'll have a decreased blood pressure, because remember I said everything gets dilated. But your patient might feel warm and flushed from the vasodilation, so you might see it in their cheeks. It can cause a coma, cardiac arrest, and platelet aggregation. You might also see a decrease in deep tendon reflexes, such as your ankle clonus. So what are some of the causes of hypermagnesemia? Of course, renal failure. That's why you got to keep an eye on your BUN and creatinine, because if your kidneys aren't flushing it out, you're going to have too much. Antacids, such as Maalox and Mylanta, and milk of magnesia, your laxatives, those have a lot of magnesium in it, so you have to be careful with those elderly. And untreated diabetic ketoacidosis. If you don't treat it, it's going to keep increasing it and cause them to have a cardiac arrest. So how do you fix hypermagnesemia? You administer your calcium gluconate, which binds to the magnesium, gets it out by the kidneys. Also, if you didn't have calcium gluconate, you can do your loop diuretics like Lasix, and then you would give them normal saline or lactated ringers, because that'll flush out your kidneys real well and get that magnesium out of there. So in a nutshell, hypo, you're going to be going. You're going to have those seizures. So make sure that you place them on seizure precautions.
Was that one, Larry? There it goes. He's going into it, Larry.
Yep.
March yourself. I got it.
Little guy. Get down. He's okay. Get down. Watch out, little guy. Watch out. This is hard.
Larry, it's only been 2 weeks.
I know.
Coming down.
Ollie, can you hear me? Ollie. Ollie, tell me when you can hear me.
Hyper, everything's going to stop. Your deep tendon reflexes, your respirations, your heart rate, your blood pressure. So keep thinking about safety. We also give magnesium sulfate for pregnant women having preeclampsia. Why is that? Well, with preeclampsia, that means they have an elevated blood pressure. So what does magnesium sulfate do to a blood pressure? Remember? Makes it go down because it causes vasodilation. To treat preeclampsia, you'll also use magnesium sulfate to decrease the blood pressure because it causes vasodilation. However, you have 2 patients on that bed. You also have the baby, so when the baby comes out, you also have to monitor for hypermagnesemia. So, of course, you look for your deep tendon reflexes, your respirations, your pulses of this infant. So, to wrap this all up, magnesium is very important in the contractility of your muscles. So you have to look at your lungs, you have to look at your heart. Those are very important. So remember what I said, hypo, you go. So you're going to be, so you might see a lot of shaking, seizure type activity, aggravation, agitation, hallucinations, that sort of thing. So you're going to see somebody that's very on the go. So hypo, on the go. I think about it, hyper, everything's the opposite. So you're going to stop. You're going to have decreased deep tendon reflexes. Your respirations are going to change. They're going to decrease. You're going to have a decrease in pulse and blood pressure. So remember, hypo, on the go, hyper, everything kind of stops. Remember your safety. If somebody's hypomagnesemia, you got to get them on seizure precautions. I'm not going to go into seizure precautions because we've heard them every semester up until now. Remember your gluconate. Your calcium gluconate is the antidote for hypermagnesemia. And don't forget, you can also use loop diuretics and normal saline or lactated ringers, just like the diabetic ketoacidosis. So keep an eye on your levels, your magnesium levels, your calcium levels, and your potassium levels. Monitor your EKGs because they can cause arrhythmias. The end? No? No?